Hello and welcome to this channel. Today we are going to discuss about randomized control trial, what is it and how to apply this in research. I have made one video about indigeneity problem, what is it, what is reverse causality bias, what is omitted variable bias, those things. And because of such indigeneity problem, we are going to use more advanced model. This is not so advanced, but the method, the technique or the design is advanced. So let's discuss about this randomized control trial. Let's say we are going to assess the impact or the influence of employee training in the performance. Beta 0, beta 1. This is our parameter of interest. It is epsilon. Then, as we have discussed in indigeneity problem, our assumption is those who receive training will perform better. This is our hypothesis, right? Our hypothesis will become those who receive training will perform better. This is our hypothesis, but let's say there is variation in performance. There is variation in performance, and this is explained by variation in training. Variation in training. But is this variation in performance only explained by training? How are other unobserved factors that are embedded in this error term, such as motivation? Can I say employee those are already motivated will also engage in training more, and then that's why they will perform higher? Then the variation in performance is not only explained by training but also unobserved factors, which is motivation. This is omitted variable bias and it causes indigeneity problem. So to omit that, here is one concept, RCT. Then how does it work? How about we randomly assign two groups. One received treatment, which is called, in this case they received training, and another group who did not receive training, did not receive training. This is called control group. In this training variable, we have two, either they receive training or they didn't receive training. But what if we design such kind of training in which individual will decide themselves to receive training or not? Then again the motivation factor will work here, because those who are motivated will register for the training, those who are not motivated will not register for the training. That's why here it comes randomly assigned. We should do randomization in assignment. Means in a group of employees, we don't know whether he is motivated or not, but one employee, 2, 3, 4, like this employees, we have their, let's say, age group, we have their education, we have their position, we have their job length, those things. Based on those characteristics, let's do randomization. Means randomly select, and let's say person 1 go for training, person 2 okay don't go for training, person 2 okay go for training, person 4, okay, do not go for training, like that. Means in this case, on average, the motivation factor will not play a role, because these two groups will be balanced in terms of their characteristics if we do such random assignments. After the outcome of random assignments, we will have treatment group and control group, and their characteristics, let's say age, their education, their position. Position means either managers or assistant, right? Then such random assignment will result into balanced on average. Means, okay, in the treatment group the average age is 30, okay, in the control group the average age is 29. The difference is 1, but these two means are not statistically significantly different, right? These are similar age. Education, okay, there are let's say the ratio of having graduate degree is 30%, here also 31%, similar, right? This way we will make the balanced group. If we maintain those baseline or the observed characteristics, observed or let's say baseline characteristics, balancing these characteristics will omit the selection bias. How? Let's say if in the treatment group the age is 35 and in the control group the age is 50, then what will you say? Because the average age is 50 means those who are already old will not be motivated to engage in the training program, but those who are young employee will be motivated to engage in the training program. That can be the explanation, which will cause the selection bias here. Hence, if we balance these two means, oh, okay, in the both group the average age is 30, around 30 to 29, which is not significantly different. Means both will have similar level of motivation, but the one and only difference is one group has training, another group has did not receive training. And in this manner we can assess this equation without any indigeneity problem, right? This is called RCT. That's why the key takeaway is this way. We will randomly assign your sample into two groups. One is treatment, next is control. For that, their characteristics, balanced, observed characteristics. How we explain? If their observed characteristics is similar, then their unobserved characteristics is also similar. This is our assumption. That's why if we observe their age, their marital status, their education, their position, their job tenure is balanced, then their motivation is also balanced, like that. That means there is no problem of endogeneity or the omitted variable bias, so that the impact or the parameter we estimate here, beta 1, which is called average treatment effect, ATE, will be the causal effect of training on the performance. This way we deal with RCT. So if you have any questions, please do comment and like, subscribe the channel, like the video, and thank you for watching.